they need that kind of authority. If they have that authority, this problem lasting for 2 hours would get solved up within, say, 5 minutes or 10 minutes. That's it. That's the fact. And then I learned about FMEA also in Analyze. That was really fantastic. FMEA did give a very good uh, picture into what needs to be solved first, on what needs to be really solved to kind of cure the problem, or all the more so, this FMEA is like nipping the problem in the bud itself before it buds out into a big problem as a flower, like in cauliflower. You can nip it in the bud itself by FMEA during either designing or process improvement stage. And then there were these other tests like two sample T test, ANOVA, chi-square test, two proportion tests, which of course I did not get to use much during my green belt, but now I've come in from black belt training and I'm learning about these, and yes, I do intend to use these intensively. It would be more interesting, very interesting. Then next came in the stage of improvement, wherein I was working with a very efficient team of doctors, team of phlebotomists, team of quality experts, with a team of uh, housekeeping staff members, uh, with a team of biomedical engineers, with a team of suppliers, with a team of distributors, with a team of sales representatives from various instrument companies and from the companies we were purchasing reagents from, and then with various application specialists of these instrument companies or from the companies of those reagents. And we sat together and did a lot of brainstorming, and fortunately they were all available and everybody seemed to be very interested. We did a lot of brainstorming. These techniques again I learned at Green Belt training in Six Sigma. That was, we learned of structured brainstorming, learned of Delphi technique, learned of Q matrix, learned of nominal thought process, and it was really very nice. We had a very structured format to work on, very structured uh, list of things to be done with clear cut prioritization of each one of them. And this did lead to quite a bit of improvement in the work setup, which of course was coupled with a lot of benchmarking, as I said, from other uh, laboratories, uh, be it standalone or hospital based labs in India or abroad, uh, because there was a lot to learn from them, and a lot to learn from them which they were good at, better than what we were doing. And with of course varying client base, and then depending on our client base we kind of modified all those procedures, adapted them to this client base, and went ahead with that. That really did help in a very big way. And now of course in the black belt training, designing of experimentation has been added, and that would be a fantastic thing to work on. Although in healthcare setup so far, experimentation on patients seems to be kind of difficult to do. That's what is done in clinical trials by pharmaceutical companies, but then that needs a lot of a lot of permissions from a lot of individuals, so that we don't do anything wrong. We don't commit an error. Alpha error should not be made. Type 1 error should not be made. So we need all those things to do. But then, uh, other than that, by DOE, we can always check the efficacy of the measurement systems. That can be checked in design of experiments. How good is the machine at measuring the glucose or the creatinine levels it's reporting? How good is the machine at measuring the homocysteine level? And what all factors can vary the report, and to what extent they would be varied? And how do I kind of, how is that reduction process possible in variation to make the results more standard, more steady? That is what we'll be looking at after doing the black belt from here. Really, that's what I'm learning about now. And then the next would be I learned of would be the control phase, wherein all the improvements you brought about in your system, they need to be controlled so that all those improvements don't go back to square one uh, when say you're on leave, or I mean they shouldn't just go back to one. It's not that the process should always be under your supervision to remain correct. The process improvement means the process should change so that the way it goes is only one way, and that is the correct way. That's it. So then we need control steps to ensure that it doesn't go out of that correct limits anymore. And in that control limits I learned of in Greenbelt was about Pokayoke. That is Pokayoke in the sense changes made during designing process itself or changes made during improvement to ensure that things never ever get out of control. That is, you need to either be informed, you need to be given a warning that yes, things would be going out of control so that proper preventive action could be taken, or uh, when things are going out of control, the system should stop so that that's it. Stop your work. Cannot go ahead. You cannot commit a mistake. The system cannot go wrong. The system prefers stopping instead of going wrong, provided stopping the system doesn't result in something very bad. Taking that into consideration. And now, of course, coming to black belt, I've learned about DOE. I've learned about new types of improvements possible. I've learned of better analytical techniques like two sample t test, ANOVA, chi-square test, two proportion test, test for median variation, test for variation of mean. Uh, it's fantastic, really. It's thrown up a good food for thought, very good food for thought, and that's it then. Uh, let's realize that healthcare is one major uh, area for application of Six Sigma techniques. For example, in the US, most consultants, a pretty large percentage of consultants of in health quality issues, especially Six Sigma specialist consultants, black belts, master black belts, most of them are involved in improvement of healthcare services.